A very good morning. I hope you people might be recognizing me. I am working as assistant professor, myself Dr. Priya Gogia, pediatrics. So today we are going to discuss about vitamins. Vitamins is a word which is derived from the combination of two words that are vital and amines. Vital means they are required for the life and amines means basically maximum of the vitamins are amines. Okay. So from there the term came vitamins. We know there are two types of vitamins. One is water soluble and one is fat soluble vitamins. In fat soluble, there is ADEK, and in water soluble, that is B and C, are the group of the vitamins which belong to water soluble vitamins. Basically, if we talk of how the fat absorption occur in the intestine, same way the fat absorption is occurring, this fat soluble vitamins will get absorbed with the help of chylomicrons and formation of chylomicrons in the intestine, and via lymphatics they will be absorbed and they will be stored in the body. If we talk of water soluble vitamins, these are B and C. These are directly absorbed in the blood from the intestine once you take it in the diet. These water soluble vitamins are not stored in the body for long time. So if you are not taking them in the diet, the deficiency will occur early. When we talk of the fat soluble vitamins, we have stores in our body, in the liver especially. So after the exploitation of that stores, if still the intake of the fat soluble vitamins is not there, then there will be the manifestation of the deficiency of fat soluble vitamins. Now, can anyone in the class tell who has coined the term vitamins? Long back in 1912, Casimir Funk was the scientist who discovered this term and who also discovered the vitamins. Now, anyone can tell about the next question? The breast milk is deficient in which vitamins? First wala bacha. You know, for the first 6 months, we are putting the child on exclusive breastfeeding. So, suppose the child is on exclusive breastfeeding and you want to tell the mother that these are the vitamins I want to supplement the child because they are not adequate in the breast milk. Vitamin B is adequate. Next, vitamin A is also adequate in breast milk. Next, vitamin K, correct. So, vitamin K, you all know that at birth, when the child is born, we are giving the child vitamin K injection. Okay, because we know there are 3 reasons we want to give vitamin K injection to the baby who is on breastfeeding. Because one thing is vitamin K does not cross the placenta. So, there are no chances that from mother to baby that vitamin K will be transferred. Another thing, in breast milk, we have very inadequate doses of vitamin K. In almost 1 liter, it is 20 microgram, which is not sufficient for the baby. Requirement is high. So, that is the another reason. And third thing, vitamin K is synthesized from the intestinal flora. If we talk of newborn, the newborn is also not having that intestinal flora to synthesize the vitamin K. So, vitamin K is one vitamin, that is why you give after birth to the baby. Another vitamin which is deficient in the breast milk is vitamin D. That is why whosoever newborn you are discharging from the NICU or from the postnatal ward, you are supplementing that child with the vitamin D. We are giving that for 1 year of life. For first year of life, we are supplementing the child with vitamin D. So now we will be discussing about the vitamin A. Now, as we can see, the vitamin A, the sources are this orange and yellow color vegetables and fruits. Whatever you are consuming, they will be having the substance called carotenoids. From this carotenoids, which you are taking in the green and yellow veggies, that especially carrots, spinach, all that will be having a rich source of provitamin, that is carotenoids. This carotenoids is having provitamin A, that is a precursor of vitamin A. As soon as you take this carotenoids in the body, it will get converted into vitamin A, that is retinol. If you don't need the vitamin A in the active form, this retinol will get stored in the liver in the form of retinol palmitate. Okay. But if it is required in the active form, especially for the vision, you required this vitamin A. So this vitamin A active form is retinol and retinoic acid. Okay. So this, if you talk of retinol, It is especially utilized in the rods and cones for the vision. So we will discuss that how it works. So it occurs in the two isoforms, cisretinal and transretinal, which is useful for the vision. Another thing, this retinoic acid and retinal, they are also important for the integrity of the epithelium. Wheresoever cell differentiation is occurring, cell growth is occurring, this vitamin A plays a vital role. So you know, whenever the deficiency is occurring of vitamin A, the skin becomes dry. You have seen the toad skin appearance in vitamin A deficiency. You have read about it. Frog-like skin or toad-like skin in cases of vitamin A deficiency, because it is responsible for epithelial integrity. If the integrity is not maintained, there will be excessive keratin deposition on the skin. That will lead to the hyperkeratotic skin. Dry cracks will be there. So that will resemble a toad skin. Now you will tell me what is bleaching. खड़े हो जाओ बच्चा, बताओ, what is bleaching? You have read any idea about opthel? थोड़ा बहुत opthel पढ़ा है? नहीं. नेक्स्ट आप बताओ कि बेटा ब्लीचिंग फिनोमेना क्या होता है. नेक्स्ट. ओके, यहाँ पे हम सेपरेशन की बात करें. आई विल टेल यू. सिट. ब्लीचिंग में क्या होता है, हमने अभी यहाँ पे देखा था कि हमको विजन के लिए दो चीजें चाहिए थी, दो आइसोमर्स थे, सिस रेटिनल एंड ट्रांस रेटिनल. ठीक है, सिस एंड ट्रांस यू नो, यू हैव बीन रीडिंग इन ऑर्गेनिक केमिस्ट्री. सिस एंड ट्रांस रेटिनल जो होता है, जब लाइट आईज पे जाएगी, जो कोन्स में होता है दैट इज आइडोप्सिन, और जो रॉड्स में होता है दैट इज रोडोप्सिन. So as soon as the light is entering the eyes, what will occur? This cis retinal will get converted to trans retinal. सारा कन्वर्जन हो जाएगा ट्रांस रेटिनल में, और फिर ट्रांस रेटिनल में बहुत सारे एंजाइमेटिक रिएक्शंस के थ्रू इस प्रोटीन से सेपरेट हो जाएगा, विच इज आइडोप्सिन एंड रोडोप्सिन. So that process of separation of retinal from the opsin, that is called bleaching. बात आया समझ में? जब ब्लीचिंग होता है तो जब ट्रांस रेटिनल अलग हो गया फ्रॉम द ऑप्सिन प्रोटीन विच वर इन द रॉड्स एंड कोन्स, तो इस सेपरेशन के बाद अगेन ये ट्रांस रेटिनल किस में कन्वर्ट होगा? सिस रेटिनल में, एंड दैट ऑप्सिन विल अगेन गो एंड कंबाइन विद द सिस रेटिनल. तो दिस प्रोसेस इज कॉल्ड ब्लीचिंग, which is occurring at the level of rods and cones. That is why deficiency जब भी विटामिन ए की होती है, the first feature to occur is night blindness. Okay? तो ये समझ में आ गया. When we are taking vitamin A, it is in the form of the keratin, that is provitamin A. It gets converted to retinol, stored in the form of retinol palmitate. When it is required in active form, it is retinal and retinoic acid, and it has two pivotal role. One is in the eyes for the vision, in which the active isomers are cis and trans retinal. When it is required in skin for epithelial integrity and for the cell differentiation and growth, both the forms are utilized. Retinal also plays a role and retinoic acid also plays a role there. Now, this is the WHO classification of xerophthalmia. तो vitamin A deficiency का जो पूरा स्पेक्ट्रम था, there is a word given to it that is called xerophthalmia. आप बेटा मुझे बताओ कि xerophthalmia क्या क्या कवर होता है xerophthalmia में? So the whole spectrum of vitamin A deficiency, which manifests as the eye problems, is considered as xerophthalmia. If we see XN, that is for night blindness. If we talk of X1A, that is considered as conjunctival xerosis. So there will be a dryness of the conjunctiva. X1B is presence of the Bitot spot. आप बताओ कि बच्चे Bitot spot क्या होता है? So there is a triangular dirty spot which can be seen on the nasal side or which can be seen on the temporal side. Usually हमको conjunctiva में दिखता है, जिस cornea के side से शुरू होगा ऐसा triangular part, dirty yellow brown color का होता है. It can be on nasal or it can be on the temporal side. That is called a Bitot spot. Okay? So X1B, B से हम याद कर सकते हैं, this is Bitot spot. So now when we are talking of X2, that is corneal xerosis. X3A and 3B are the corneal ulcer or keratomalacia. If it is X3A, that is occupying less than 1/3 of the corneal surface, and if it is X3B, that is extensive ulcer, which is occupying more than 1/3 of the corneal surface. XS is when scarring will occur due to that ulcer, that is XS, and XF is fundal changes will occur due to this vitamin A deficiency. Everyone is clear with this classification? This is very important as your MBBS exam is considered. Otherwise also you should know about the xerophthalmia. Okay. Now, who will tell what is carotenemia? Last one. What is carotenemia? Next. हमने अभी बात की थी जो भी ग्रीन येलो वेजिटेबल्स था उसमें क्या था? कैरोटीनॉइड्स था. When you excessively take that vegetables or that veggies in diet, that will lead to the excessive discoloration, yellowish discoloration of your skin. That is called carotenemia. तो अब कोई ऐसा बच्चा है जो बहुत ज्यादा कैरेट कंज्यूम कर रहा है डे एंड नाइट, if he will consume that for long time, what will occur? There will be a yellowish hue or there is yellowish discoloration of the especially palms and soles and skin. But in that cases जहाँ पे भी लूज स्किन है वहाँ डिस्कलरेशन होगा, बट स्क्लेरा विल बी स्पेयर्ड. ठीक है, तो दैट इज ड्यू टू कैरोटीनीमिया. नाउ दिस कैरोटीनीमिया, एंड ऐसे बच्चे आते भी हैं इन पीडियाट्रिक प्रैक्टिस. आई हैव सीन 1 to 2 cases, not much, but they come, there is sudden yellow discoloration of the skin, but eyes will be spared in that cases. Now how you will treat them? You will just stop the intake of the carotene. In 2 to 6 weeks it will get reversed to normal skin color. So that is carotenemia. Getting? Carotenemia समझ में आया? Now what is hypervitaminosis है? आप बताओगे बेटा? Excessive intake of vitamin A. So it can be acute excessive intake or it can be chronically taking daily into the excessive doses. Okay. So when you are taking acutely, it will manifest as pseudotumor cerebri. Okay, pseudotumor cerebri mein what will occur? There will be features of raised intracranial tension in the brain. It will manifest in the form of fundal changes, papilledema will be there, headache will be there, vomiting will be there, signs of raised intracranial pressure will be there. So that is because it is resembling like a tumor in the head. That is why it is called pseudotumor cerebri. Although there is no tumor, it is occurring either due to certain drugs or due to intake of large amount of certain vitamins like vitamin A, vitamin D. This fat soluble vitamin को जब हम excess में ले लेते हैं तो pseudotumor cerebri is one of the common manifestation. Okay, so acute manifestation में most common is pseudotumor cerebri. When you talk of chronic intake, जब हम excessive amount में करते हैं, that will lead to the manifestation in form of skin में changes हमको मिलेंगे, or there will be changes in the hairs. So alopecia is one of the common manifestation. Due to excessive deposition, there may be hepatosplenomegaly. Also, there may be joint pain due to excessive intake of the vitamin A. So, these are the manifestations of the excessive intake of vitamin A. Now, RD of vitamin A. Who will tell the RD of vitamin A? No idea. She is correct, 700 to 900, but that is in adolescent and adults. When we are talking of the young kids, so the dose is 300 to 400 microgram, okay, in infants, and for younger kids we will give 400 to 600 microgram. For adolescent we will give 750 microgram per day. Okay, this is the RD of vitamin A. Now moving ahead to vitamin K, it occurs in two forms, that is phylloquinone and minaquinone. The topic may seem to be theoretical, but it is important. So try to concentrate. Once you will read here, you can read by yourself and get all the details. Okay. So this vitamin K, if we talk of vitamin K, it occurs in two forms. One is phylloquinone and one is minaquinone. Now absorption is same as the fat absorption occurs. You will take in intestine with the help of the pancreatic and bile juices. This will get broken down. In jejunum it will be absorbed. It will combine with the chylomicrons and will get absorbed in the lymphatics. From lymphatics it will be absorbed in the blood and then it will be stored in the liver. That is how fats are digested from the body. So same digestion and absorption will occur for the fat soluble vitamins. So vitamin K is a fat soluble vitamin. It will be absorbed through the same process. Now, why vitamin K is important? Because it acts as a cofactor for carboxylation of the coagulation factors like 2, 7, 9, 10. So it is required for the activation of this coagulation factors which are 2, 7 and 9, 10. So if vitamin K will not be there, what will occur? The coagulation will be hampered. So if coagulation will be hampered, it will manifest in the form of bleeding. Okay, so there will be ecchymosis, there will be bleeding manifestation from the mucosal sites. So all will be the manifestation of this. The sources for vitamin K are two. The term you can see phyloquinone because it is having quinone ring in its structure. That is why quinone is used. Phylo means from plant. So whatever is derived from the plants, that is green leafy vegetables, is phyloquinone. Menaquinone is one which is synthesized in the body. Intestine mein flora will synthesize. Endogenous synthesis will occur. So that occurs in the form of menaquinone. Okay. So this is clear. Now we discussed why newborns require vitamin K. आप बताएंगे बच्चा? While we were starting the class, we discussed that why newborns require vitamin K at birth. In adequate doses. It contains, but it does not contain in the adequate doses. Another thing, another reason is intestinal flora is not established in newborns. So that is why there is no chances that there will be endogenous synthesis of vitamin K in the newborns. Okay, another reason we discussed was it does not cross the placenta. So during pregnancy also the child will not get the source of vitamin K. Okay, so these are the reasons we want to supplement the child with the vitamin K. Vitamin K is given as an injection 0.5 mg in preterms and 1 mg in the terms, given at anterolateral aspect of thigh, given as a IM doses. Okay, so once you will attend your newborn posting, you will understand. Another question is, what is hemorrhagic disease of newborn? Who will tell about the hemorrhagic disease of newborn? आप बताओ. Hemorrhagic disease of newborn is a specific term which is used for vitamin K deficiency in the newborn, leading to the bleeding manifestation in form of ecchymosis or bleeding. This may occur due to somebody has not given the vitamin K shot at birth. That might be the one reason. Another reason, the mother might be taking warfarin, heparin or some other drugs which are leading to more coagulopathy. Okay, vitamin K antagonist she might be taking, so that might be leading to bleeding manifestation. All that can lead to hemorrhagic disease of the newborn. Now, hemorrhagic disease of newborn has three types. One is early onset, one is classical onset, and one is late onset hemorrhagic disease of newborn. Early onset is when the bleeding manifestation are occurring within 24 hours of life. That are called early onset hemorrhagic disease of newborn. When it is occurring from day 2 to day 7, it is called classical onset. And when it is occurring beyond 7 days, it is called late onset hemorrhagic disease of newborn. What will occur in such cases? Like they will have a bleeding from the umbilical stump. A newborn might be having a bleeding from the umbilical stump, or the bleeding may be from the GI tract or from the nose, or there might be ecchymotic patches. All this can occur. Especially it occurs in the form of bleeding like from umbilical stump, GI, or sometimes rarely there might be intracranial bleed also. That severe disease can occur in the newborn due to deficiency of this. Okay, so these are the common manifestation. Another thing, if somebody is having, so this apart from this newborn, if somebody is having a disease which is leading to malabsorption of the fat, like somebody is having pancreatic insufficiency, so this fat absorption is not occurring in the body. Okay, or due to some intestinal pathology, absorption is not occurring, they can also have this vitamin K deficiency. Another reason can be liver disease. Okay. So in liver disease also we can have the manifestation of this. So since there is no activation of 2, 7, 9, 10, what will occur? There will be prolongation of the prothrombin time and activated thromboplastin. APTT and PT will get derailed in such cases. Okay. Now next is daily requirement in newborn. So daily requirement is around 30 to 50 microgram per day. And if you talk of the breast milk, in 1 liter there will be 20 microgram, and you know the output during the breastfeeding is, during initial days it is 300 ml. Later on, when the maximum output occurs, it is around 500 ml. Now 500 ml will contain about 10 microgram, and the requirement is 30 to 50 microgram per day. So that is why the demand is not met with the breast milk. Okay. Now we will discuss about the vitamin E, that is tocopherol. Okay. So in preterm, if we talk, the preterm requirement is quite high. That is 15 to 20 microgram per day. In terms, it is around 0.4. This should be corrected. It is mg per kg per day. And in infants, it is 3 to 6 mg per day. Now sources are that can be via vegetable oils or leafy vegetables or milks or egg. Deficiency of vitamin E lead to the manifestation in form of can be in the form of muscle weakness, peripheral neuropathy, or hemolytic anemia. Okay, these are the manifestations of vitamin E. It is not that common to see the vitamin E deficiency, but somebody having muscle cramps during the night especially, the cause can be vitamin E deficiency. Okay, in preterm babies especially, if vitamin E is not supplemented, they may have manifestation in form of hemolytic disease. If hemolytic disease will occur, how it will manifest? Jaundice will occur due to hemolysis. What else will occur? There will be pallor, there will be icterus. So there will be anemia and jaundice in cases of hemolysis. What else will occur in lab parameters? Hyperbilirubinemia will be there. What else? Lower RBC counts मिलेगा. इतना ज़्यादा synthesis होने लगेगा. RBC counts will be high. Retic count will be high. LDH will be high. Haptoglobulin will be low. So all this will be the manifestation of the hemolytic anemia. Now in preterm especially, if vitamin E deficiency is there, it will manifest in the form of hemolytic anemia. And in that case, if you will give iron on top of that, there will be more severe hemolysis. Okay. So if somebody asks you what is the presentation of vitamin E deficiency in cases of preterm babies, so what you will say, how it will occur? At the end of the class, I am going to ask everyone. Whosoever will not answer, attendance will be not be given to that child. Jaundice anemia. So it will manifest in the form of hemolytic anemia. So we discussed about vitamin E. We discussed about vitamin K. We discussed about vitamin A. Okay. For vitamin D, a separate class will be taken. Now we are moving to the group of water soluble vitamins, that is vitamin B. So we will be discussing about the thiamine. So thiamine is also called as vitamin B1. Okay. This thiamine, it is basically required for the carbohydrate metabolism. So if you are taking 100 kilocalories of this 100 I'm saying 1000 calories of carbohydrate, 0.4 milligram will be required. Active form of thiamine is thiamine pyrophosphate. If we talk of the dietary sources of vitamin B1, egg, milk, legumes or meat are the sources. Deficiency will lead to the manifestation in form of beriberi. Okay. So can you tell about wet beriberi? Any idea about the wet beriberi? What it is, how it manifests? Next wala bachcho. Okay. So wet beriberi, can, from the name we can see wet means there will be fluid overload. So manifestation will be in the form of the congestive cardiac failure. So they will have anasarca, they will have signs of congestive cardiac failure. When we are talking of dry beriberi, it will manifest in form of peripheral neuropathy. Okay. There will be more of a nervous system involvement in cases of dry beriberi. Infantile beriberi will have a combined feature of dry and wet beriberi, and it is a fatal condition. Okay. Usually, if not identified on time, the child will not survive. Okay. In infantile beriberi, there will be cyanosis, there will be congestive cardiac failure, there will be encephalopathy. All this will be the manifestation of the infantile beriberi. Now we know in alcoholics, in adults, we have read about the Wernicke's encephalopathy, Korsakoff psychosis. All these are the manifestation due to the deficiency of thiamine. Okay. So somebody who is suffering from malabsorption syndrome, or who is having some intestinal problem, intestine has been cut short, that is short bowel syndrome is there, or celiac disease, or inflammatory bowel disease. So any of the condition in which the absorption is hampered, it will lead to the deficiency of thiamine, and it will manifest as beriberi. Okay. Now, how you will diagnose the condition of B1 deficiency or thiamine deficiency? Either you can calculate the urinary excretion, because it is a water soluble vitamin, so it will be excreted in the urine. So if it is not excreted in the adequate amount, that means the deficiency is there. So that is one way. Otherwise, you can see the enzymatic activity of this transketolase. So transketolase activity is another way through which you can identify the thiamine deficiency. Now for treatment, the treatment is very simple. You are just going to supplement with thiamine, that is 5 mg per day. It can be given oral, or in severe condition IV form can be used. So this is about B1. Now moving to B2. Now if we talk of B2, that is riboflavin. That enzyme we discussed was required for transketolase activity. Now if we talk of this, this is again required for the carbohydrates. So for per 1000 calories, we require 0.4 milligram. Active form is required for the act as a coenzyme for the FMN, FAD, xanthine oxidase and glutathione reductase. तो जितना भी oxidation reduction reaction होता है, that occurs with the help of the riboflavin. So it is very important for all this. तो free radical scavenging के लिए this is required. So this plays an important role in oxidation reduction reaction, and it acts as a coenzyme for FMN, FAD, xanthine oxidase and glutathione reductase. Dietary sources are same as we read for the B1, egg, meat, milk and cereals and vegetables. Now deficiency of B2 leads to a spectrum of symptoms, in which there will be manifestation in form of photophobia will be there. There will be angular cheilitis. You might have seen the people having a cut over their angles of the mouth, that is angular cheilitis. There may be glossitis also. There can be corneal vascularization, and at times they can also have seborrhea. So all these are manifestation of riboflavin deficiency. Many times in exam it is asked that child is suffering from photophobia, child is having angular stomatitis. Still photophobia, you think of vitamin A deficiency. You don't think of riboflavin. So riboflavin can have this whole spectrum. Again, to have a diagnosis of riboflavin deficiency, what you are going to see is, you are going to see the urinary excretion of riboflavin, and another thing is, you can check the activity of the enzyme. It will be hampered if coenzyme is not there. So glutathione reductase activity. Then for treatment, you are going to supplement the child with the riboflavin 3 to 10 mg per day. Now another is vitamin B3, that is niacin. Okay, niacin, if we see, niacin is derived from tryptophan. So whatever amino acids you are taking tryptophan, 60:1 is the ratio of conversion for tryptophan to niacin. Another thing, dietary sources are same, egg, cereals, milk and leafy vegetables. The deficiency of the niacin leads to pellagra. That are the three, it consists of 3 Ds. Can you tell about the 3 Ds of pellagra? Dermatitis is 1, dementia is 1, dementia, dermatitis and diarrhea are the manifestation of the niacin deficiency. If not treated on time, it may lead to death also. Okay. This dermatitis has a typical appearance on the sun exposed parts, that is called casein nacreous appearance. Hai na? This is very common in alcoholics, or if the person is suffering from any kind of malabsorption syndrome. Also, it is associated with the drug intake, that is isoniazid, which is an anti-tubercular drug. Okay. Then diagnosis is again with the help of urinary excretion of niacin. You can calculate if the child is deficient or is having adequate niacin. Treatment is with the help of the niacin, that is 50 to 300 milligram per day, which is given 10 times of the RDA. Now pantothenic acid, this is B5. B5 pantothenic acid, sources are same. Dietary sources are all natural food are having this. It may also be synthesized by the microorganisms. It's a part of coenzyme A, and it is required for fatty acid, protein and carbohydrate metabolism in all three. Manifestation of pantothenic acid deficiency occurs in form of, कैसे होता है? पेंटोथेनिक एसिड डेफिशिएंट है तो कैसे मैनिफेस्ट करेगा? यूजुअली दे विल कंप्लेन ऑफ बर्निंग फीट, so there will be a sensation of burning feet, and also there will be insomnia, and another manifestation will be in the form of GI symptoms. It may be abdominal pain, nausea or vomiting. All this can occur whenever there is a pantothenic acid deficiency. Daily need is around 2 to 3 mg per day. Now another is pyridoxine. Now when you talk of pyridoxine, the deficiency is common again with the antitubercular drug isoniazid. It may also occur in the patients having malabsorption. Then diagnosis is same by calculating the urinary excretion of the B6. Treatment is with supplementing pyridoxine. 10 to 50 mg ka tablet is available, which we are commonly giving with the ATT also. So whenever you are prescribing a ATT to someone, you also add pyridoxine because you want to prevent the peripheral neuropathy which occurs due to isoniazid when the patient take isoniazid for a long time. Okay. So the manifestation due to pyridoxine deficiency can be in the form of peripheral neuropathy. In newborns, sometimes refractory seizures can occur due to this pyridoxine deficiency. Another thing is dermatitis can occur due to B6 or microcytic anemia. Dietary sources are sunflower seeds, yeast, soya beans and walnuts. And for supplementation, if for refractory seizures, we give as much as 100 mg also. So it is given IV. Somebody has seen pyridoxine deficiency in newborns. So I usually, if a newborn comes with a seizure, what you will do, you will check for the hypoglycemia, if it is there or not. Suppose you check, there is no hypoglycemia. Then you checked hypocalcemia. These are the common causes of neonatal seizures. No hypocalcemia was there. Then you loaded with anti-seizure medication. Like you started with the phenobarb or phenytoin, then you loaded with the valproate or levodopa. But if 2 anti-seizure medication के maximum doses के बाद भी the seizures are not in adequate doses आपने दिया, then also seizures are not getting controlled, that are labeled as refractory seizures. So one of the very common cause of refractory seizures is this pyridoxine deficiency. Okay, so one is that. Peripheral neuropathy, have you seen how it manifests? Peripheral neuropathy can have two components. Okay, it can be motor or it can be sensory. When sensory neuropathy is occurring due to the involvement of the sensory nerve, it will have the manifestation in form of tingling, numbness, paresthesia will be there. Okay, burning feet sensation will be there. So that will be the manifestation in sensory. Okay, at time when the nerve is completely damaged, at times you will lose all the sensations. That can also occur. So neuropathy will manifest in the form of the neuropathic pain in form of paresthesia, and or hyperalgesia can also be there. All this manifestation can occur. When motor involvement is occurring, motor neuropathy is occurring, foot drop can be the manifestation. Okay, motor weakness can be there depending on which nerve is affected. So such can be the manifestation of the peripheral neuropathy. Okay, so usually with this pyridoxine deficiency, sensory peripheral neuropathy is more common. Now talking of B7, that is biotin. Biotin, there is a relation between the evident protein and the biotin. And if there is a deficiency of this B7, there will be skin and hair manifestation in the form of glossitis, scaly dermatitis, anorexia. Also, there will be hypercholesterolemia. One of the common genetic condition which may be seen in the early infancy, which is very easy to treat, but the manifestation can be very lethal. If there is a genetic deficiency of multiple carboxylase enzyme, so there will be a deficiency of this multiple carboxylase deficiency. There is basically deficiency of this carboxylase synthetase enzyme. So there will be no biotin in the body. There will be the manifestation in the form of eczema or skin condition. Also there may be alopecia or hair changes in the baby. Also it can manifest in the form of seizures, encephalopathy. Such can be the manifestation of the multiple carboxylase deficiency. But if you timely identify this genetic condition, if you just supplement with biotin, condition is treatable, curable. Curable in the sense you can treat it, but you cannot remove the genetic deficiency which is occurring due to the genetic mutation. Treatment is giving 2 to 5 mg of oral biotin daily for 2 to 3 weeks. Now folic acid. This is more of theoretical, but I just want you to have an idea so that once you have an idea and you go and read, it will become little easy. Getting or not getting? थोड़ा थोड़ा if you will imbibe, घर जाके read it once, so you will get. So another is folic acid, which is B9. Okay. This folic acid acts as a coenzyme for RNA and DNA synthesis. The sources are from leafy vegetables, beans, peas, cereals, and sunflower seeds. The requirement is of 25 microgram in infants and 200 microgram in adolescent. The deficiency of folic acid can lead to the presentation in form of macrocytic anemia, hemolytic anemia. It can lead to the malabsorption also. No, it is common in cases of, basically, have you read the causes of macrocytic anemia? So one of them is folic acid deficiency, one is B12 deficiency, another causes are liver disease or hypothyroidism. So one of the common manifestation of folic acid deficiency is in the form of macrocytic anemia. Okay. Neural tube defect can also occur if the mother is deficient in folic acid. Okay. तो न्यूरल ट्यूब डिफेक्ट कौन बताएगा? आप बताओगे बेटा न्यूरल ट्यूब डिफेक्ट क्या होता है? न्यूरल ट्यूब डिफेक्ट कब बनती है न्यूरल ट्यूब? व्हाट इज एंटीरियर न्यूरोपोर एंड व्हाट इज पोस्टीरियर न्यूरोपोर? एनाटॉमी तो पढ़ के आए ना? देखो जहाँ पे भी सेल का ज्यादा टर्नओवर है, there will be requirement of this folic acid because it is required for the DNA and RNA synthesis. So अब suppose if the child is suffering from sickle cell disease or thalassemia, so what is occurring? RBCs are breaking down too rapidly. Now what this child will need? Folic acid for supplementation. So whenever you are sitting in the OPD and you are attending a child with the sickle cell disease or thalassemia, what you are writing commonly? Tablet folic acid. Writing na? Why you are writing? Because of hemolysis, what is occurring? There is increased turnover, more synthesis of RBCs. So for synthesis of a cell, what we need? DNA and RNA. For that synthesis, folic acid will be required. So to meet the demand, excessive demand which is occurring to the rapid hemolysis, we commonly give in hemolytic diseases the supplementation of the folic acid. So one is hemolytic disease which makes them prone for the folic acid deficiency. Another are certain drugs, like if somebody is taking methotrexate, okay, or somebody is taking 6-mercaptopurine, such are the drugs, okay, which will lead to inhibition of the metabolism of this folic acid. So for that conditions also we need to supplement the child with the folic acid. Now another thing is malabsorption syndromes, like we discussed. In any of the cases in which there is intestinal disease, mucosa is not proper for absorption, or there is a short bowel syndrome, or there is a celiac disease or inflammatory bowel disease, on all this intestinal condition, again the absorption of the folic acid will not occur. So these are the situation in which the deficiency will manifest, or certain anticonvulsant also lead to the folic acid deficiency. Then if the erythropoiesis is affected, it will lead to the manifestation in form of megaloblastic anemia. If maternal deficiencies occur in the baby, we will have a neural tube defects. Neural tube defects, when the neural tube is forming, if folic acid is not in proper amount, there will be defects. Okay, that can be primary neural tube defect or can be secondary neural tube defect. Like the cranial vault is not formed properly, that is called anencephaly. So anencephaly is one of the very common neural tube defect. Another is development of myelomeningocele. Myelomeningocele, so there is herniation of the content. It can occur from the brain, it can occur from the upper cord or lower cord. So there can be cervical myelomeningocele, or it can be this. If it is the brain part is coming out as a herniated part, that is called encephalocele. So encephalocele can also occur. Myelomeningocele can also occur. Myelomeningocele means spinal cord along with the meninges is herniating out as a pouch. So this myelomeningocele can occur in the cervical region, lumbar region, thoracic region can occur. Okay, so it basically occurs due to a deficiency of a small vitamin, that is folic acid. Okay, so these are the primary neural tube defect. Secondary neural tube defect, which can occur in the form of meningocele can occur, spina bifida can occur, spina bifida aperta, occulta can occur. So all these are manifestation in form of secondary neural tube defect. What we will do for neural tube defect prevention? मदर को क्या करोगे? फॉलिक एसिड से सप्लीमेंट करोगे. न्यूरल ट्यूब जो फॉर्मेशन हो रहा है वो कब हो रहा है? फर्स्ट ट्राइमेस्टर में हो रहा है, 23rd 25th डे पे हो रहा है, एंटीरियर न्यूरोपोर तुम्हारा 23rd डे पे बन रहा है, 25th डे पे बन रहा है, तो हम क्या करेंगे, दिस फॉलिक एसिड विल बी गिवन बिफोर कंसेप्शन। तो प्री कंसेप्शन तुम 1 महीने के लिए मदर को दोगे एंड नेक्स्ट 3 months मोर यू विल गिव फॉलिक एसिड। 10 times हम डोज देते हैं जो हम प्रिवेंशन के लिए देते हैं। फॉर प्रिवेंशन वी आर गिविंग 0.4 mg, फॉर ट्रीटमेंट की सेकेंड बेबी में ना हो उसके लिए हम कितना देते हैं, 4 mg। तो सपोज इफ मदर कम्स विद अ चाइल्ड विद अ न्यूरल ट्यूब डिफेक्ट, शी इज प्लानिंग अ सेकेंड प्रेगनेंसी, आप पकड़ के फॉलिक एसिड दोगे, ठीक है, ताकि मदर को नेक्स्ट बेबी में फॉलिक एसिड डेफिशिएंसी की वजह से न्यूरल ट्यूब डिफेक्ट्स नहीं आना चाहिए। क्लियर? फॉर प्रिवेंशन यू नो वी आर गिविंग इन प्रेगनेंसी दैट इज 0.4 mg। तो दिस इज ऑल अबाउट फॉलिक एसिड। एंड जितना भी वाटर सॉल्युबल विटामिन्स है, टॉक्सिसिटी विल नॉट अकर इवन इफ यू विल गिव इन एक्सेस अमाउंट, इट विल बी एक्सक्रीटेड इन द यूरिन। जितना बॉडी को चाहिए उतना इंटेस्टाइन से एब्जॉर्ब होगा, रेस्ट विल बी एक्सक्रीटेड। टॉक्सिसिटी इज कॉमन इन फैट सॉल्युबल विटामिन्स, क्योंकि वो काइलोमाइक्रॉन्स के थ्रू एब्जॉर्प्शन के बाद दे आर गेटिंग स्टोर्ड इन द ऑर्गन्स लाइक लिवर एंड स्प्लीन, तो वो जाके स्टोर हो रहे हैं, तो दैट विल हैव अ टॉक्सिसिटी। नाउ कोबालामीन, कोबालामीन इज B12. There are 3 compounds, that is methylcobalamin, deoxycobalamin or cyanocobalamin. Sources are animals or humans, and also we get B12 from the dairy products, egg and meat. Absorption occur when through the gastric parietal cell intrinsic factor is excreted, and this extrinsic factor make a complex with B12. From ileum this complex is absorbed by the process of simple diffusion, and the more the enterohepatic circulation will be, more will be the T half of it. In plasma, when B12 enters, it gets combined with the transcobalamin 2. So that is how it is transported. So B12 deficiency also, when we are discussing this B12 deficiency, it can be due to the dietary problems also. If somebody is not taking in the diet, especially vegetarians, vegan diet does not contain the adequate amount of the B12. It is mainly present in the this animal products, meat and all. So if somebody is vegan, chances are more for developing this B12 deficiency. Another thing is also sometimes there is deficiency of this intrinsic factor, that is pernicious anemia we call. So that can also occur. Another thing is genetic defect can also be there in which this transcobalamin 2 is not working properly or the receptor is not working properly. So multiple reasons can lead to this B12 deficiency. Now, deficiency can occur due to the vegan diet, due to the intrinsic factor deficiency, absorption when the B12 combines with the intrinsic factor occurs in the ileum of this B12. So, if somebody is having the ileal disease, ileum is not proper, like due to the diseases like tuberculosis or inflammatory bowel disease, if integrity of ileum is hampered, that can lead to the malabsorption of B12. Also, if the mother is not having adequate amount of B12 in the body, that the infant can also become deficient in B12. Now, RDA for B12 is in infants it is 0.3, for children it is 0.5 to 1.5, for adolescent it is 2 microgram. Assessment, how we do, we just get a blood test done in which we will test for the serum B12 levels. If any time it is less than 150 picogram, then we will label the child as having B12 deficiency. There are 2 regimes for supplementing the B12 to the baby. One is initially we used to say कि mega doses में आप दे दो daily and the B12 recovery will occur. But now we are saying कि whenever the child is having developmental delay or neurological manifestation, we will go slow with this B12 supplementation. So we start at low doses and slowly weekly we increment the B12 doses. Also we can assess with the help of the plasma. आप बताओगे बेटा what is MMA? B12 deficiency है ना, they are writing to test, to do some test. क्या है MMA, क्या टेस्ट है? नेक्स्ट, हाँ बताओ बेटा. नेक्स्ट, हाँ, it is methylmalonic acid and HC is homocysteine. Okay, so these are the byproducts in the pathway of the B12. So we can assess with the help of the plasma methylmalonic acid and homocysteine. They will be elevated in cases of B12 deficiency. Now, what are the clinical manifestation of B12 deficiency? It can occur in form of progressive demyelination, which can involve the peripheral nerves, or it can involve the posterior column of the spinal cord, or it can also involve the cranial nervous system, central nervous system, and it can also manifest in the form of megaloblastic anemia, in which in PS you will get classically the hypersegmented neutrophils. When we call hypersegmented neutrophils, न्यूट्रोफिल देखा है आपने, यूजुअली कितने लोब्स होते हैं उसमें? हाँ, और हाइपर सेगमेंटेड कब बोलते हैं? 5 से ज़्यादा होंगे तो वी विल कॉल इट एज हाइपर सेगमेंटेड पॉलिप. So this is pathognomic. If it is present, it is usually suggestive of megaloblastic anemia, which is occurring due to the B12 deficiency. Also, there will be elevated LDH. The treatment is supplementing parenteral B12. If no malabsorption or nothing is there, you can also go ahead with the oral B12. Now, vitamin C. Vitamin C, 2-3 things you can remember from C. One is, this is present in the citrus fruits. So all the oranges, gooseberry and all, they contain the vitamin C. Another thing, it is required for the collagen and connective tissue synthesis. So it is important in that. Another thing is, it is lost in cooking. So it is labile to cooking. So if you will cook something having vitamin C, it will go away. It also acts as a reducing agent. Daily requirement is 30 to 40 mg in infants and 40 to 70 mg in children. Now, if you talk of storage, basically vitamin C is stored in leukocytes, adrenals and pituitary. So, there are very different organs where the storage will occur. Usually, it's a water soluble. It will not be stored in a very high amount, but small amount will be stored here. Another thing, how it will manifest. If a child comes to you in the OPD, okay, and mother is saying the child is very irritable, the child is not eating anything, the child is not having appetite, okay, the child is apathetic, not getting involved. Another thing, you start, after taking a good history from the mother, you started examination. When you're examining that child, the child is not allowing you to touch. Okay, you cannot touch his thigh, you cannot examine. So basically the child was having tender bones. Okay, the child will, mother is saying that the child is not moving from the bed, is keep on lying in the bed. That is pseudoparalysis. Okay, due to the bony tenderness, what will happen? The child will not move the leg, although there is no paralysis, but the child will keep on sitting or lying. The child will not walk. Also, there may be appearance in the form of pitted frog appearance. Okay, due to pain, the child will like, pitted frog देखा है किसी ने? ऐसे frog को उल्टा देखा है कभी ऐसे? तो pitted frog में क्या होगा? They will not move. They will just keep lying on the bed like this. So this all occur as a manifestation of vitamin C deficiency. Okay. Another is we know for connective tissue का एक primary important component is vitamin C. तो connective tissue synthesis के लिए चाहिए, collagen के लिए चाहिए. तो जो वेसल वॉल होते हैं उसमें भी हमको पता है कि देयर इज इन्वॉल्वमेंट ऑफ द कोलेजन. तो जब वेसल वॉल जो रहेगा, वेसल वॉल प्रॉपर नहीं रहेगा, इजीली रप्चर हो जाएगा, तो देयर विल बी मैनिफेस्टेशन इन द फॉर्म ऑफ पेरीफॉलिकुलर हेमरेजेस. तो वन ऑफ द मैनिफेस्टेशन ऑफ विटामिन सी डेफिशिएंसी इज इन द फॉर्म ऑफ पेरीफॉलिकुलर हेमरेज. जो हेयर फॉलिकल्स होते हैं उनके अराउंड हमको रेड डॉट मिलेगा. ठीक है, दैट इज पेरीफॉलिकुलर हेमरेज. So this occurs due to capillary fragility because the wall has become fragile. Okay, it will get easily ruptured. So these are the manifestation of scurvy. Scorbutic rosary हमको एंगल पे मिलती है. जब हम रैकेटिक रोजरी की बात करते हैं तो रैकेटिक रोजरी जो हम जंक्शन पे पढ़ते हैं, कॉस्टोकॉन्ड्रियल जंक्शन, जब रैकेटिक रोजरी की बात होती है तो इट इज राउंडेड, इट इज नॉट टेंडर. द चाइल्ड विल अलाउ यू टू एग्जामिन. वहीं जब स्कॉर्ब्यूटिक रोजरी बनती है बोन में, तो इट इज यूजुअली एंगुलेटेड प्रोमिनेंस होंगे, है ना, एंगुलर रोजरी मिलेगी एंड दैट विल बी वेरी टेंडर. द चाइल्ड विल नॉट अलाउ यू टू टच. तो स्कर्वी का मैनिफेस्टेशन अगर हम देखें तो स्कर्वी में द चाइल्ड विल बी यूजुअली इरिटेबल, एनोरेक्सिक, अनीमिक, विल हैव अ pseudoparalysis, will have a scorbutic rosary, and also due to capillary fragility there will be perifollicular hemorrhages. So you need to know about the vitamin C clinical features as well as radiological features. If you talk of radiological features, We know due to this capillary fragility, what will occur? Bleeding will also occur in the periosteum. So there will be subperiosteal hemorrhages which will occur, which will lead to the elevation. ये ऐसा जो पेरियोस्टियम है वो बोन से एलिवेट होकर हमको दिखेगा. That is subperiosteal collection will occur. Subperiosteal hematoma will occur. Also, there will be a tremor field zone. It's like this. This sharp line will occur around the epiphysis. That is called Wimberger ring sign. जो हमको कॉर्टेक्स के साइड में शार्प लाइन डेवलप होगी, दैट विल बी कॉल्ड एज, क्या बोलते हैं उसको, पेंसिल कॉर्टेक्स. तो स्कर्वी के मैनिफेस्टेशन, लेट मी टेल यू वंस. अंदर का जो पूरा बोन है वो रेरिफाइड हो गया है और जो एजेस है वो पूरा शार्पली डिफाइंड हो जाएगा. ठीक है. तो जब हम कॉर्टेक्स की बात करते हैं तो कॉर्टेक्स विल बी विजिबल एज अ पेंसिल थिन कॉर्टेक्स. शार्प कॉर्टेक्स विल बी देयर. देयर विल बी अ, जो एपिफाइसिस नीचे हम देखें, ये तो हम बात कर रहे हैं डायफाइसिस की और मेटाफाइसिस की. जब हम एपिफाइसिस की बात कर रहे हैं, एपिफाइसिस के अराउंड देयर विल बी अ फॉर्मेशन ऑफ द शार्प रिंग, दैट विल बी कॉल्ड एज विमबर्गर रिंग. जब हम मेटाफाइसिस में देख रहे हैं तो एक जोन डेवलप होता है, जोन ऑफ रेरिफ्रैक्शन. ठीक है, क्योंकि प्रॉपर बोन फॉर्मेशन नहीं हो रहा है. तो जो जोन ऑफ रेरिफैक्शन है दैट विल बी विजिबल एज ए डार्क जोन. तो दैट विल बी कॉल्ड एज ट्रमर फील्ड जोन. दिख रहा है वो एपिफाइसिस के जस्ट ऊपर डार्क ब्लैक. This black zone will develop here. That is called tremor field zone, and this ring will form, that is called a Wimberger ring. And यहाँ पे हम देखेंगे तो pencil sharp cortex will be there, and there will be a development of the white sharp line of Frankel. Also at time there will be a bony rising from the side of the bone, that will be called as Falcon spur. So all these are the manifestation of the scurvy. कुछ आया समझ कि नहीं? बेसिकली इट्स अ थियोरेटिकल टॉपिक, यू हैव टू गो एंड रीड. किसी को कुछ डाउट्स है तो यू कैन आस्क.